I'll go ahead and get started. Hi, everybody. My name is Esther. I am one of the co-directors for the Safer Disinfection Project under the Northwest Pediatric Environmental Health Specialty Unit. There are many different specialty units across the nation. We're just one of 10 different regions. And our mission is to improve child health outcomes through consultation and education. And our funding mainly comes from US EPA and CDC. And we do these types of education and outreach events. We do trainings for health professionals, whether you're a clinician, you're a community health worker, and we have free consultations and referrals. So if you have any concerns or questions around environmental health in general or specific, we're there to talk to you. And so today I wanted to talk specifically about cleaning and disinfecting, especially since we're all doing more of that in the time of COVID, and talk to you all about some of the dangers of the more commonly used one that's more found in homes, and some safer alternatives and other strategies to safely clean and disinfect and keep our families and our children safer. So we all know that, the virus that causes COVID-19 is spread mainly through air. And I think earlier in the pandemic, there had been concerns on, is it transmitted on surface or whatnot? So we all started to use cleaners more, we're hand washing more, we're using hand sanitizers more. And so this is a good time, and I guess it's always a good time to talk about ways we can keep our children and family safe, keep illness in general from spreading from one to another, and to do it safely in the way. I'm curious, and I'm not sure if folks if folks are able to chat if they can about, have you started cleaning more or using disinfectants more during the pandemic? Because I know I have, but I'm also not sure, how people have been doing. And I don't know if folks are, okay, I'm starting to see some coming in, and we're just looking for hand sanitizers. We're really hand washing the full, I think, trying to wash, 20 seconds or more, which is a long time considering, what are some of our practices were before. So just a quick recap of the difference between cleaning and disinfection. Cleaning means, physically removing the germs and the dirt off of the surface. And germs could be bacteria and virus and others. And so you're physically removing them by washing, wiping, and rinsing. And disinfection actually refers to killing those germs off of the surfaces itself. And usually it's like a hard surface that you're disinfecting, since cloths you can't disinfect the same way. And so we wanted to just go over, when you might consider disinfecting, which is not all the time, every time, because that is a lot of chemical exposure and families and children getting into contact with chemicals a lot. So we really want to reduce that. So we say, if nobody is sick in your home, and if you are, everybody is otherwise healthy, then cleaning is enough. Cleaning can help improve your indoor air quality, remove allergens, germs on surfaces. And so we do that, I think almost every day depending on which counter or surface it is, but using soaps and water, using microfiber cloth if you can, and then cleaning those high touch surface areas like kitchen tables, doorknobs, bathroom sinks, your maybe your floor, the changing table, all these different types of things like the refrigerator door. You would be cleaning, and that should be enough. You might consider disinfecting, the changing table itself or the toilet around the area, the floor, whatnot. But you might also consider disinfecting if someone is sick in your home, or if you suspect that someone might be sick in your home. What's really, really important to remember is that you always want to clean first. Even if you are going to disinfect, you always want to clean first and remove some of that dirt and the germs off of the surface. And that way the disinfectant can actually do its job better and best when you do that. So you're probably familiar with both of these. These are most commonly used disinfectants. Bleach is one of them, and quaternary ammonium compounds, or quats for short, is the other one. And you see these in lots of different bottles, like, a concentrated bottle like the bleach on top in the picture, spray bottles, and wipes. So wipes are becoming extremely popular these days, and a lot of them are actually quats. And you want to think about, some of the potential dangers here because they're not completely safe. They can cause skin irritation, eye irritations, or burns. And for those that have respiratory issues or is more sensitive to these chemicals, these bleach and quaternary ammonia or quats can really hurt those people, and in some cases actually create asthma in some cases. So some strategies to think about that, think about reducing your overall exposure or risk, is to really know what the active ingredients are. So how do you know if it's bleach in your everyday cleaner or quaternary ammonia? You would look on the bottles and you would look for the section that's called active ingredients. And for bleach or for quaternary ammonia, it'll have the word in there, ammonium chloride, as we have boxed here in two different types of chemicals. And so these active ingredients can have a mix of different chemicals from the disinfectants that we buy. Some might be like anti-foaming agents. Sometimes you might just see a single line item, like even our toothpaste has active ingredients listed on them. And so these are required things that companies are supposed to list them. So these are some ways for you to know what is in your disinfectant. So one strategy is to just look for safer ingredients in general. So instead of looking for things with bleach or with quaternary ammonium or quats, you can look for things that say hydrogen peroxide, ethanol, isopropanol, citric acid. This list is available and I'll send these slides out too. So these are some ways where you can think about actually purchasing things that are healthier or could be less dangerous to the families and to the children. Another way to think about purchasing safer options is to look for logos on the bottles. So these logos are some examples: Eco Logo, Green Seal, Safer Choice, and Design for the Environment. These are four example logos where they have to go through a certification process to be safer for people, for pets, for environment, for water quality. So for all of these, they actually need to go through that process to be able to get that logo on there. So in general, if it has one of these logos, it's a safer option compared to bleach and quaternary ammonia. Now, in general, you want to make sure no matter what product you're using, whether it's bleach or quat or a safer ingredient, you want to read your labels very carefully because every single one is actually different. And I've come to learn that even for bleach bottles, it might look the same, but the concentration for each bottle will be different. And so I'm sure for some of you, like me, I used to make just like 5% bleach and I would just use the same recipe. Turns out I really need to be reading the directions for every single bottle I purchase because they're all very different. And they have different labels. So for example, if you just want to clean, spray and wipe might be all they say. But if you actually want to disinfect, it might actually say something like keep the surface wet for 10 minutes, for 4 minutes. It'll actually be very specific. And you want to also have enough of the chemical on the surface to leave it wet and glisteningly wet. So because of those reasons, you really want to read the labels carefully. And then there are other words on there that you might look for. So for example, if it says danger, it's considered, to have a lot of risks or a lot of danger associated with that chemical, compared to if it says warning or if it says caution. Caution is actually the safest of those three words that you might see on the bottle. And so that's just one of some strategies you can do. No matter what you use, since these are chemicals, you want to wear gloves if you can, whatever type of glove it is, as long as it can protect your hand and skin. You can wear eye protection so that it can prevent anything splashing directly into your eye. So regular glasses like I have on could be fine. If you just have Halloween glasses or swim goggles, those could also serve that same purpose to add that initial barrier so if something splashes towards you, it doesn't get into your eye. And of course, these other ones that you all are familiar with, like washing hands right after you use them, diluting chemicals as instructed, and always following the labels and instructions. And these are some other ways to think about just improving the air quality while you're using the chemicals. So opening windows, turning on your kitchen or your bathroom fan when you're actually using these chemicals. If you have child-safe fans at home or air cleaners, turning them on while you're using it and right after as well can keep the family safe. And also trying to make sure that the child, the baby, or a pregnant person isn't nearby when you're using these chemicals is also a effective strategy. Another thing here is thinking about, where we store them. I have a 1.5-year-old, and so I'm having to go through and figure out what things he's going to crawl into. And so making sure that children can't get access to any of these chemicals, no matter which option it is. So whether it's child-proof locks or just simply keeping them out of reach completely from children is super important. And then just thinking about improving indoor air quality in general. If you have portable home air cleaners with the HEPA filter, you can use them. And if you want to think about other sources of irritants for children that might be sensitive to different things in the air, reducing smoking indoors or not using candles or air fresheners or fireplaces are also some other strategies to improve your indoor air quality. So just as a recap, if you forget everything else, just remember you want to clean first and then disinfect if necessary. And read the labels very carefully for the actual instructions for each individual product when you can. And then disinfectants can be really dangerous if you don't use them properly. So for example, if you mix chemicals, you should never mix chemicals because they can have unintended consequences and can have serious health effects. And then when you can, do look for safer alternatives if available. And if you're going to use what's in your kitchen like bleach, then make sure to really dilute and follow the necessary precautions to keep yourself and the family safe. So we are here. We're here for additional conversations, similar training like this, in-depth conversations. If you want to get trained to give this training yourself, I can also do that with you for about an hour-long training. And then we can also do individual one-on-one education sessions with families specifically. And we have an in-house person that can give this education session in Amharic. And so that is also an option as well. And the email is there, but after this event, I'll make sure that these slides and the resources that we have connected to these. So there are some additional links that you might look into. For example, cleanawaycovid.org is one of the web pages where it has lots of it's a clean web page, very white, very clean. And it has a lot of interactive videos. There's a music video that really emphasizes cleaning for children so they can kind of listen along, and it's kind of catchy. And then there are some printable take-home materials that are available as a PDF. And then we're in the process of creating some comic books so that families can go over it with some older children. And we're also working on making stickers so that kids can use them for their notebooks and whatnot. So those will become shortly available, and I'll make sure to pass that along to the families here. So yeah, I'll pause right here and see if there are any questions.
Thank you so much. I do have a question. I think because of COVID, but also because of like the population that I serve, I'm a doula. A lot of folks really like alternatives to things. And I see a lot of like DIY vinegar cleaners, DIY, those sorts of things, especially now that we're like really into wipes and making our own wipes. And a lot of people were doing a lot of DIY, especially at the beginning of COVID. I guess I'm wondering, are those sufficient cleaners versus disinfectants, and how you feel about homemade cleaners?
I guess it really depends on, what's going in there, because at the bottom line, what's the ingredients going in? Are they safe or are they not? So I think, I've seen folks with recipes for making their own hand sanitizers, which use alcohol or ethanol, which is on that safer ingredient list. But I think it totally depends on the recipes. And if you have any questions or concerns, you can always, email me, and then we can talk about any specific recipes you might have. I think in general, it's harder to make disinfectants at home with the ingredients that are made available to you, other than the I think alcohol is the main recipe I've seen. It's easier to make cleaners, and it's good to, I think, use those green cleaning kits, like I think baking soda and vinegar mixes, which I try to do at home too. And so, and those are great for children, you know, and for families that are expecting and with babies around, because those aren't irritating for people.
Thank you. That was my next question, like age appropriate cleaning.
Yeah, I think in all situations, the best you can, you know, you don't want to do any of these and use any chemicals around children if possible. And then in addition, you know, protecting yourself, whoever is the one that's going to be doing the cleaning and disinfecting, you know, really thinking about airflow and maximizing airflow, even if it's in the winter. You know, I still try to open my window and turn on the kitchen fan to kind of get things moving when I'm cleaning, and then I close it right up when I'm done because it's cold. But yeah, thinking about those additional strategies to keep yourself safe, plus, yeah, the children around you.
Awesome. Any other questions? Last minute questions? Oh, is Nagesti, somebody saying Nagesti is speaking, but we can't hear you.
Yeah.
There we go. There we go.
I have one question now. To prevent the health of our health and the health of our families, can we use as a disinfectant alcohol only instead of using wipes, because they are now creating sinusitis and harming of the asthmatic people?
Yeah, so I think there are wipes that have alcohol in them, and those are fine. I think the wipes, if you would look at the ingredients, some are quats or the quaternary ammonium, so you do want to reduce or try not to use them. I think one thing I forgot to mention is when you can, using wipes is better than using sprays, since sprays will really kick up and aerosolize a lot of the chemicals, and you can breathe it in versus wipes can. And so that is one of the strategies. And yeah, definitely if you can, using alcohol-based things more than the quats or not Clorox, bleach-based things. There are some brands that we associate with certain chemicals, but Clorox actually produces both quats and bleach. And so that's why you got to read the active ingredients, because my brain just, automatically assumes, and you don't want to do that.
Okay, thank you.
Well, I'll pass it back to you, Urkia, and I'll hang around too. So if there are any other questions that come up, and I'll put my email in the chat as well, so people can reach out to me directly.
Wonderful. Thank you so much, Esther. That was a wonderful presentation, so thorough. I've been sharing with everybody. Every time I hear you speak, I'm like, wow. It just the distinction is, I think it's really helpful for people to understand. So I'm so glad you can join us. All right, so we'll just keep it moving right along. Naisha, I believe you are here. So our next guest speaker is Naisha Williams. Naisha is the BIPOC lead at King County Public Health. So she has the beautiful and wonderful distinction of considering Black and Brown families as new policies and procedures are happening in regards to COVID or in response to COVID. And Naisha, did you, I already made you a host, so if you had a slide or anything that you needed to share, by all means, the floor is yours.
Thank you, and good evening, everyone. Just let me know when you can see my screen.
Absolutely.
I have about 8 slides. I'm gonna kind of walk everyone through. Yes, my name is Naisha Williams, and I'm leading COVID vaccination for BIPOC communities. And so I just want to give some general information. Let's see, it looks like I may be frozen. Let me change the slideshow here. Maybe that will help. Is that a better view for everyone?
That looks great.
Okay,
Thank
perfect.
you.
I was like, it's looking kind of small. Yes, so I want to just kind of educate everyone just around the general parameters with the vaccine, and hopefully provide some information that you'll find helpful. So first I want to talk about, vaccine safety. So we want everyone to understand that the vaccines are safe and, effective. So all of the COVID vaccines, we have 3 that are available. We have the Pfizer vaccine, the Moderna vaccine, and also Johnson & Johnson. The Pfizer and Moderna vaccine are using the mRNA technology. And so all 3 of the vaccines went through the rigorous testing and evaluation through the FDA. And so they are authorized for emergency use. And so I get a lot of questions about the side effects, and they're pretty routine with, other vaccines that we receive. So it's usually like sore arm, fever, headaches, fatigue, and these are actually signs that your body is building up that immunity. And so for the Pfizer and Moderna vaccines, the messenger RNA or mRNA is pretty much a substance that our bodies naturally produce. And so the mRNA technology utilizing the vaccine is just teaching our bodies to protect us by making those antibodies and infection fighting cells. And so it's just important to know that the vaccine, I've gotten a lot of questions about whether the vaccine can enter the nucleus and change our DNA. And so it does not change our DNA in any way. It cannot enter the cell nucleus. And so once the mRNA vaccine is pretty much done teaching our cells, how to fight off infection, it's no longer in our bodies. And so that's important to note because I've gotten a lot of concerns about mRNA technology and staying inside of our bodies. And so it essentially is just teaching our bodies how to fight off the virus. You will need 2 doses, and this is important. It's typically 3 to 4 weeks apart. And this is to make sure that you have the full protection. And so it's for these 2-dose vaccines. If you are told that you need 2 shots, please get 2 shots. And so I get a lot of concerns about mRNA, also because it's fairly new. So mRNA technology has been around for over a decade. It's been utilized in cancer research and also by the National Institutes of Health. And so we know that one of the scientists leading that research is an African-American woman, Kizzy Corbet. And also, there is a Turkish oncology couple. They're both oncologists that also have been using the mRNA technology in their cancer research. And so we get a lot of questions about, well, how are the vaccines created so quickly? And I like to highlight that it was a global collaboration and that there were a lot of BIPOC folks involved in the development of the vaccine. In addition to the scientists that I referenced and the doctors, there's also a Nigerian doctor out of Yale that's overseeing, he initially was overseeing HIV research, but he is now leading the clinical trials for COVID vaccination. And so it's not only, just investing a lot of money to move research forward fairly quickly, but it's also that global collaboration. And a lot of BIPOC scientists were involved in the collaboration to ensure that this vaccine, not only is that it's safe and that it was able to be developed so quickly. Looking at the Johnson & Johnson vaccine, which is fairly new on the market compared to the other two, but it's also extremely effective against hospitalization and death from COVID-19. And so Johnson & Johnson vaccine is slightly different. It's not an mRNA based vaccine. It's more so based on the virus's genetic instructions for building that spike protein. You only need one shot to be fully vaccinated. And it's 85% effective in, preventing severe COVID. And usually you can get that immunity around 28 days after vaccination. And so, yes, the efficacy rate is a little bit different from the mRNA vaccines that are 95% effective. However, I like to also highlight the fact that Johnson & Johnson vaccines, where their clinical trials were happening in the presence of the African and Brazilian, the Brazilian and UK variants. And so we know that they're highly, highly effective and can provide that protection against severe COVID-19. And then moving to pregnancy. So we know, as we've expanded the phases, that pregnant people are currently eligible for vaccination. The COVID-19 vaccine, it acts as a form of protection by preventing that severe illness. And that also is important in pregnancy because it can also assist with those risks for pregnancy complications related to COVID. So having the vaccine could lower that risk. And so, according to the CDC, over 60,000 pregnant people have received the vaccine. And that has been since around December of 2020. And so the CDC is reporting that they haven't experienced any additional safety concerns or differences in rates of complications. And then we do know that pregnant and lactating people were not specifically included in the initial clinical trials. But again, just looking at that 60,000 participants or recipients of the vaccine since December 2020, we know that we haven't received any evidence of any additional complications or risks to the vaccines. And so it's just important to know that the vaccines will not infect you with coronavirus. The vaccines do not contain any tracking chips, pork products, or harmful metals or toxic ingredients. And again, the vaccines can cause mild flu-like symptoms, but extreme reactions are very rare. Again, the typical side effects is headaches, sore arm, fatigue, potentially fever. However, for severe allergic reactions like anaphylaxis, they're very rare. And when they happen, we do have protocols in place. So, and speaking as someone who has a history of anaphylaxis and has received the Pfizer vaccine, the typical protocol is to wait around about 15 minutes. And if you do have a history of allergic reactions, then the vaccine provider will ask you to wait around for observation for about 30 minutes. For those who aren't familiar with anaphylaxis, typically those who have those severe reactions carry EpiPens. And so it's associated with extreme swelling of the tongue, the throat. Sometimes you can become a little hoarse. And it's one of those type of reactions that the onset is really, really quickly. From my experience, within 10 minutes. I hear questions like, well, what if, I have a severe reaction, later on after I receive the vaccine? Anaphylaxis has an onset really, really quickly, and it's visible. So even if you cannot communicate that, you know, something isn't right, it's the symptoms are pretty visible for the provider. And so that's what those observation periods are. And so it's a little bit longer for those who have history of severe reactions, but there are protocols in place. And anaphylaxis is treatable. So although it may sound a little scary, we already do have EpiPens and Benadryl, and we're prepared to treat anaphylaxis. So those safeguards are in place. But overall, it's just important to understand that the COVID-19 vaccines will reduce hospitalization and deaths from COVID, especially in communities of color who have been really, really severely impacted by COVID. And then I often hear about the need for continued social distancing, even with the vaccines. But you know, what we have seen with these variants is that the more people interact, it increases the possibility of the infection. And what it also does is kind of teaches the virus how to change and mutate and, you know, escape our immune system's attack. And so viruses are smart, and they also want to survive. And so one of the ways that we can, you know, kind of mitigate the mutations is to continue to follow those safety precautions, like wearing our mask and social distancing, until we can get a larger proportion of the community vaccinated. And so getting vaccinated in King County, we just want everyone to know that the vaccines are provided at no cost. So the vaccine administration fees are covered by Medicare, Medicaid, and most private insurance. And so, you know, some providers will ask for insurance, but community members, those who are getting vaccinated, do not have to pay any copays. So the vaccine is free. Again, additionally, your provider should not charge you for the vaccine. And just understanding that the vaccine will prevent you from getting sick, but it's not known whether it can prevent you from spreading it to others. So what we've seen so far, that we know that some people are positive for COVID, but what we call asymptomatic, which means that they're not presenting any symptoms. However, they're highly contagious at different phases, you know, with COVID. So this is highly possible when vaccinated. And so, again, we want people to continue to wear their mask, maintain that 6 feet apart, minimize gatherings, and also, you know, as the supply increases, more, you know, more people will be eligible for vaccine. It'll just be more available. We're coming up on the April 15th date where vaccine will be eligible for everyone. So we're increasing our supply, and eventually everyone who wants to receive a vaccine will be able to get one. And so some scheduling options to consider, of course, is your doctor's office. However, we no longer are using Face Finder, but we do have a vaccination locator tool where you can look up potential vaccine access points throughout the community, whether it's pharmacies, community health centers, and also there are also what we're calling community vaccination events or pop-ups throughout the community as well. And so we also have a public information communication center that can help guide those interested in making an appointment for a vaccine, to just steer them in the right direction and where to go. And I wanted to stop right there and see if there were any questions. I think I'm seeing the chat light up.
Yes, we had some folks talking about the issue of people being asked for their social security number when showing up to vaccination appointments, and how that's not necessary. You shouldn't be asked for that information. You also shouldn't be asked for your insurance information. I have, in the case of getting tested for COVID, been asked, even though that was also free,
Yes.
because I realized maybe some facilities were looking for ways to help cover the cost of materials for testing.
Yes. Yes.
But it's my understanding that in either case, it's not required to have either your social security number or insurance.
That is correct. You know, the vaccine is free. And so vaccine providers are requesting insurance to cover that administrative cost. But if you decline, and I mean, hey, if you do not have insurance, you will not be turned away for vaccine. Also, thinking about those who are undocumented, that will not hinder your ability to receive the vaccine either.
Mm-hmm. Awesome. Any questions? And Naisha, do you mind putting, if there's like a website or any links you have to the vaccine phase finder in the chat?
Yeah,
folks can.
We're using what we're calling the vaccine locator.
Okay, thank you.
And so the vaccine locator, we've kind of sunset phase finder just because the phases are sunsetting. And so, yes, I can drop that in the chat, but it works very similar to phase finder, where you can put in your information like your zip code and find the nearest access point for a vaccine. And that's really helpful because again, it's not just doctors' offices that are providing vaccine, it's also pharmacies, and then there's a lot of community vaccination events happening all around King County as well.
Mm-hmm. Yes. So we had a question pop up in the chat. It says, this is from Mary. It says, I understand they recommend the vaccine for pregnant women, but what about during the first trimester when it's higher risk anyway?
Yes. So it's recommended that pregnant women receive the vaccine whenever they possibly can. So as soon as possible, just because it builds that immunity. And that's highly important because all trimesters you're vulnerable. However, in the first trimester, there's an increased vulnerability there. So it's very important to meet with, you know, whether it's your midwife or your doctor, nurse practitioner, and just create a vaccination plan. You know, the overall recommendation is to receive the vaccine. However, it's also a good idea to communicate with your provider because sometimes there's a little deviation from the plan if there's any underlying health conditions. However, that's another reason to really consider the vaccine because our bodies are really vulnerable, just pregnancy in general. I have 4 children, so I know how that goes. And so, you know, with our body essentially weakened because we're supporting another human being, things that we would normally be able to fight off, it's harder to fight off colds. You know, a lot of things breathing becomes harder as you progress. And so it's really important to get vaccinated as soon as possible, especially with the variants, because they are more contagious and transmitted more easily, more quickly. So that's also why that precaution is there. That advisory is there for pregnant women to get vaccinated as soon as possible.
Yeah, excellent. Awesome. And I'm just going to call out some folks. We do have some other, folks in the room who are, you know, working really hard to support communities of color through this pandemic. Celie, I'm sorry, friend, I'm going to call you out.
That's
Celie,
my colleague.
yeah, also works for King County, is in the room. And I know that Celie also has more direct information about the upcoming COVID events. We also have Srilata Ramala, who is the executive director of the Maternal Coalition. We co-conspired to create the COVID vaccine information that's been shared around in the community to provide more information for pregnant and expecting families. And so I know Srilata has been sharing some information in the chat here as well.
Yeah, I see this comment in the chat, and precisely.
Sarah.
So I see, and I can repeat it. So
yeah, please, so that the rest of the group can hear.
Yeah.
Thank you.
Also for the translation. Yes, I got you.
Yes.
So Sarah is saying that I read on CNN that a new study said the Pfizer, BioNTech, and Moderna coronavirus vaccines are effective and safe for pregnant women and lactating women. Researchers say they found antibodies in umbilical cord blood and breast milk samples, suggesting that the vaccine can protect the mother and the baby as well. And have you heard about this? And this is correct. So also thinking about the flu vaccine. You get the flu vaccine in pregnancy, it provides that protection, it produces those antibodies, and it provides protection for the babies. We know that babies cannot be vaccinated for the flu before 6 months. So when we're thinking about the COVID vaccine, same concept. You're providing that immunity for your child. And it's even more important because right now, you know, we do not have a approved vaccine for under 16. So that immunity is really, really, really important, especially for newborns and those who cannot receive that vaccination. So that's another form of protection. So absolutely.
And Naisha, do you mind speaking a little bit more about, you know, folks that have already, let's say they've already gotten the virus and they are getting antibodies, right? If they are surviving the virus, but what other things should folks still be mindful of, even though they have these antibodies?
Well, you should be still mindful with COVID-19, and we're still, you know, studies are still happening because we're still pretty much in the thick of it. But there are, what we're seeing so far, just in a year in, that there are post-COVID complications. And so that's another form of just thinking about prevention and getting the vaccine. We don't know what the long-term implications of COVID, having the coronavirus, will have on our body, but we're already seeing for those who have had COVID a lot, especially if they had, you know, underlying conditions, like for instance, if someone already had asthma or heart disease or any underlying condition, we're also seeing a lot of post-COVID complications. And when I say post-COVID, you know, folks are testing negative for COVID, you know, so they've had COVID, it's run its course, but there's those lingering complications, you know, that people are still having that's affecting them. And we don't know if that will be short-term or long-term because it's still actively happening. And so another thing to think about in terms of prevention is, you know, getting the vaccine to not only prevent getting COVID, but also those potential complications that can really, really, really be serious, depending on we're even seeing post-COVID complications in those who don't have underlying conditions. So young people who are healthy and then having those complications. And then we're seeing more people who are designated as young and healthy having severe cases of COVID when it comes to the variants. So again, vaccine is highly, highly important, especially since we know that communities of color have been severely impacted by COVID. And so, and that's in terms of contracting COVID, and also when we're looking at deaths attributed to COVID. So vaccine is really, really important.
Yeah. So I have a question actually via text message that's asking about, you know, because we, you know, there's no experiment or, you know, testing that can be done on a pregnant person. And we cannot test the effects of the vaccine on a fetus, right? So a baby in utero, we have no way of knowing exactly how it will affect the baby. You know, there's some concern around what happens if a pregnant person receives the vaccine and they miscarry, or what happens if, you know, the baby is born with a defect. Like those are, you know, some really real concerns that people hold. And I know you spoke to kind of the makeup of the vaccine earlier. Based on that information, can you speak to these concerns?
Well, I see the question in the chat as well about the Johnson & Johnson vaccine. So I'll touch on that really quickly. The vaccine is basically based off of the virus, like genetic instructions for building the spike protein. And that essentially is just teaching our body how to fight off the virus. And so Johnson & Johnson vaccine is very similar to other vaccines that we received in general. And it's the same concept. Technology is different from mRNA, but the same concept of teaching your body how to fight off the virus. It's basically training boot camp for your body to boost that immunity and fight off the virus. And then in terms of yes, there hasn't been any clinical trials in pregnant women, of course, or lactating women. However, as I was noting earlier, since December 2020, there have been 60,000 pregnant people who have received the vaccine. And we haven't had any reported miscarriages or any complications related to the vaccine. And so, no, we don't have that clinical trial, but the data is showing us that there isn't an inherent risk from receiving the vaccine on pregnant people.
That's really, really good to know. Thank you. And so I want to check in with Sarah L. You were asking about the technologies that Johnson & Johnson uses. Was that,
yes.
Was that question answered well for you, Sarah? Is that clear what Naisha?
I see the further question. Yes, it uses similar technology. And so it's more similar to what we're traditionally accustomed to with vaccines for the Johnson & Johnson vaccine. And again, it's just training camp to build your system's immunity. And so it does not contain the live virus. You cannot get COVID from any of the vaccines. And it's essentially using that spike protein just to train your body to identify the virus and fight it off more quickly.
Okay, and then just further, Sarah is asking if there are any recommendations on if you plan to get pregnant. Would the Johnson & Johnson vaccine be the best one to consider, or consider them all, or what is consider them all? Yeah.
Consider them all. We're recommending, so we have, you know, different laboratories or organizations or pharmaceutical companies who have gotten involved in creating vaccine. And so it's not that any of the vaccines are inferior. It's just think of it where we have Tylenol. We also have Advil. We also have Motrin. So they all provide, they all alleviate pain. And so neither is, you know, good or bad. And so it's not necessarily a comparison. It's more so that we have more tools in our toolkit to fight the virus. And so if you're planning to get pregnant, if you're already pregnant or you're lactating, please just get any vaccine that is available to you. And that is our overall recommendation, is just to get vaccinated.
Absolutely. So I think there's another question that popped up in the chat from Maria. If you're planning to get pregnant, is there any benefit to waiting a couple of months after getting the vaccine before trying? So should you get the vaccine and wait before you attempt to get pregnant, or?
No. It's totally safe for pregnant women. So, you know, if you're trying to conceive, and you obtain the vaccine, there isn't any waiting period. It's just, it'll build your immunity. And again, at all phases of pregnancy, your body is vulnerable. And so it's recommended to go ahead and get vaccinated. It's actually a good game plan to get it as you're trying to conceive, just to kind of get it out of the way. But it's recommended in general, even for those trying to conceive, to receive the vaccine.
So I have a question also. This is Nifty. This is good for me because I was concerned. I have taken the 2 vaccinations before 2 months, but I'm concerned. By that time, it's okay for me. Just the second vaccination was making me dizzy, fatigue, and also nausea. But I am concerned always. Even I didn't sleep. I have to take the vaccination, but I didn't sleep. Is there any complications in the long run? Till now, I didn't see. Is there any complications in the long run?
So far, we have not identified any complications in the clinical trials. Again, it's been since December. The CDC is looking back at, you know, December, which 60,000 pregnant women and no complications. However, there hasn't been any clinical identification of complications, but we are seeing already in that same time frame, we're seeing the complications for those who've had COVID. So that's another way to look at it. So we don't have the long-term data just because it hasn't been that long, you know, since the vaccines have been available. But what we've seen so far is there hasn't been any added complications or increased risk in pregnant people, but we are seeing those increased risks and complications for pregnant people who are contracting COVID. And then I see in the chat, why is there a 90-day recommendation to wait for the vaccine after having COVID? Are there reported side effects in people who have received the vaccine after having COVID? In general, whether you've had COVID exposure or not, the common side effects for COVID vaccine are the headache, the sore arm, the fatigue, and the fever. And they have since relaxed that recommendation to wait 90 days. The new recommendation is to get the vaccine as soon as you can get the vaccine.
Wonderful. Any other questions, guys? We have an expert in the room, so no question is too big, too small, too silly. Now's a good time to ask any questions.
No such thing as a silly question.
No such thing.
Sorry, I have a question.
Yes.
In regards to that 90-day recommendation to wait, I thought that the CDC was still recommending if you had received like convalescent plasma treatment to still wait. Is that accurate, or is that changed too?
Well, the CDC has relaxed the recommendation for COVID in terms of the waiting period. But in terms of other conditions, it's still the advisory is to consult with your medical provider. And so in some cases, some medical providers, depending, it's kind of one of those things where it's based on the individual, will, you know, make the recommendation to get the vaccine. And then, you know, in other cases, it may be recommended to, you know, have a specific waiting period. But in that case, it would be something to consult with a doctor about whether you should wait or not. And it's totally based on the individual and other health history as well.
And for the room, Rebecca, would you mind explaining convalescent plasma? Or Naisha, can someone explain what that is? I don't think a lot of people have heard of that before.
I'll leave that to Rebecca.
Oh, well, the convalescent plasma is the treatment of plasma that was from an infected person with COVID. So somebody who already had COVID and recovered, and their plasma is collected, and then it's provided as treatment to a patient who is ill with COVID. I mean, the reason why I ask these questions is actually related to, a family member receiving treatment and then getting the vaccine. So it was just interesting. I'm just wondering.
No, it's a great question. But in that case, again, it's more based on the individual, just because there's other factors that come into play, especially with other potential health conditions. And so that's one case. And well, there's many cases where we would recommend that folks would consult with their doctors. And thank you for that question.
Yeah, really good question. Okay, going once, going twice. Any last questions? All right.
Happy to hang around. So if anything comes up in the chat, I'm happy to answer anything in the chat too. Awesome.
Thank you so much.
Yeah.
Really appreciate you coming. That was so super helpful.
Thank you.
Yeah,
Thank
this
you for having me.
information. Yeah, we need to keep spreading the word. So thank you.
Absolutely. Thank you for having me.
Yes. Okay, wonderful. So next we are gonna have our we have Jasmine B. We also have, there's two Jasmine, so I always go Jasmine B for short, but we have Jasmine Bryant, and we also have Jackie Vaughn, and we have Jasmine Williams, all here from Surge Reproductive Justice Northwest. And they are here to talk with us about vaccine hesitancy, the history of vaccines, and the benefits of it for our communities. I'm going to go on ahead and pin you all to the main screen. Thank you so much for coming. I'm super excited for y'all's talk. And this is more of a discussion piece, you guys. So we are inviting everyone in the space to weigh in, share, ask questions. Yeah, please absolutely add to the dialogue here, but I know that they do have a little bit to share with us right now. So without further ado, ladies, please take it away.
Thank you, Rokia. One, thank you for organizing this event and all the folks who spoke today and shared this really important information. My name is Jackie Vaughn. I'm the Executive Director of Surge Reproductive Justice. We are a Black woman, femme, queer-led organization in Southeast Seattle. We do our work around community organizing and advocacy centered in a reproductive justice framework, which for us really means looking at how are we shifting power, how are we building spaces similar to this in our community where we're able to have these conversations, think critically together, and really look at how all of the different aspects that that we need to have healthy, thriving bodies, children, families, and communities, how all of that is connected together, and also how specifically here in the US, how all of that is impacted by racism and gender-based violence. And so this discussion around COVID-19, using the reproductive justice framework, like we don't look at this as a singular or siloed issue. We all have seen the data and reports of the disproportionate impacts of COVID-19 in BIPOC communities, whether that be infection rates, dying from COVID-related symptoms, as well as the economic impacts when we think about the education system and this virtual learning
I feel like, test run that they did this year. We know BIPOC students have been disproportionately impacted on their access to virtual learning and particularly getting their needs met. And so all of these things are connected, and using the reproductive justice framework, we really hit hard on making sure we're looking at the full picture of what our communities need to be healthy and thriving. And so with that, we wanted to join this conversation and partner with Open Arms today on this discussion to really kind of add that critical piece of looking at history. I know particularly in BIPOC communities, there's been a lot of conversations around hesitancy and fear around the vaccine. And while we completely appreciate Naisha's information and really just letting us be able to have the chance to talk to somebody who looks like us and is from our community about the vaccine is so important. And we know that that's not often the case for a lot of folks in our communities, to have that space and access to someone who's from public health, but also from our community as well. And so we really wanted to share some information tonight to look at the history of vaccines in our community. One, to validate our experiences and hesitancies, that it's not coming from a random place. This is coming from the harm that has happened in our communities over generations of the medical industrial complex, and particularly vaccines and testing new medications out on our communities. So validating and acknowledging that that is our experience as BIPOC communities as a way to help create an environment of educated consent. That while I know everyone has got through their part fairly quickly, I'm happy because that will leave more time after our discussion for you all to ask those critical questions to the folks, the experts that we have in this room. And so with that, I'm going to pass it off to my colleague, Jasmine Williams, who has information and background about some of the experiences that particularly BIPOC communities have had. And Jasmine Williams, if you're not able to, I feel like Jasmine Bryant is able to tap in and support.
Yeah. My colleague Jasmine Williams has 2 young ones, so I know a lot of y'all are parenting at night. Shocker, parenting all day, probably too. We wanted to highlight the history of specifically BIPOC communities and the medical industrial complex, right? And I think that it starts with like that Dr. Marion Sims, the father of gynecology, right? The founder or father of gynecology earned his title by experimenting on enslaved Black women who could not consent because they were enslaved, right? And without any anesthesia, without permission, and that these things are held in the bodies of existing Black women who are descendants of these folks, that this sort of history lives in our body through generations, through generational trauma. It manifests in our reproductive health. Moving from that really violent history to actual forced sterilizations of Black and Native communities as a part of the eugenics movement, that over a 6-year period, there followed a passage of the Family Planning Services in 1970, where physicians sterilized almost 25% of Native American women of childbearing age. And we're seeing these same sorts of things showing up in the detention centers that are existing under ICE in our current moment. These things are not gone, and they are not invisible to us, and they have a legacy that manifests here today. Let me see, I think I got pinged by Jasmine. Yeah, she's calming down her kiddo. We know, Jasmine, we're here with you. And even when we think about modern birth control and how birth control was actually, it manifested again out of the eugenics movement, because poor communities, which happen to be communities of color, were sort of prescribed as like our having children was a problem for the US economy, when in fact it's a part of our human rights to actually have children, right? And how deeply associated the history of IUDs are, as well as the birth control testing in Puerto Rico and all of the sterilizations that happened with that, as Puerto Rican women were subject to these initial human trials so that birth control can, we can determine whether or not birth control is effective. Right. And then we have this added layer, and I think we touched on it as we were discussing with Naisha, is that a lot of these trials aren't done on women, on lactating women, on pregnant women, often because our bodies aren't seen as the medical neutral body, right? Typically it is men or male bodies, or bodies that are not in childbearing years that are being involved in these studies. And that has another layer of just how deeply rooted gynecology is in the harm of women, as opposed to the health of women and femmes and all people with uteruses, to open up a more inclusive way of thinking about this. So yeah, I wanted to acknowledge all of that. And I was a little worried about closing because that's such a bummer. It's such a sad history to tap into at the end of like a really energetic like discussion with Naisha. I feel like your energy was so captivating, and I love your smile. But we're also trying to just contextualize where we're at and why our communities have this specific hesitancy, and how rooted it is in the continual exploitation of our bodies. And also like when someone who's been abused systemically over time is told what to do with their body, that there is resistance inherently in that, right? I think a lot of folks in our community don't want the vaccine, partly because they have little information on it, and also because they don't want to just get something that someone is telling them to get within this historical context of being experimented on. And I wanted to acknowledge and honor that we carry all of these things in our body, and that when we get informed conversations like the one that Naisha just led, and the one that Esther just led, and the one that Rokia beautifully facilitated and opened up for us, that bodily autonomy becomes possible only when we're informed. And that when we say we want you to get a vaccine, we want you to get a vaccine with informed consent. We want you to get a vaccine because you know that it's good for your body and your community, and because you feel safe doing so. And I also want to just decolonize the history around vaccinations, because we think about, and I think that this goes back to like, you know, my public school education, that we think about Edward Jenner being like the father of vaccines, because he like experimented with cows who had cowpox, and started like a variolation process that taught him how to inoculate for smallpox. But I want to decolonize this because even 100 years prior to that, it's documented that in Boston, an enslaved man named Onesimus taught his master variolation practices that were from his African tribe. So I want to just say that variolation, the science behind variolation, the whole taking an infected material and giving it to someone who is healthy so that they have antibodies that fight off. That's a practice that Indigenous people have been doing since the beginning of time. That we are the ones who taught it, that the reason why so many African folks didn't get smallpox is because they had this practice of variolation in their communities. And so I just want to acknowledge that, because vaccines are Black history. And when Naisha says that she wants you to get the vaccine, when we say we want you to get the vaccine, it's because that's part of our practice of keeping our communities safe. This isn't just the medical industrial complex, but this is like folks who look like you, who have always looked like you, who have always used this practice, inviting you to flex your bodily autonomy, to have access to a vaccine should you want one, and to feel safe and comfortable in choosing whatever it is that you decide, because this is our practice, and to take just some pride in that. And I'd like to open it back up to questions for me, for Naisha, who I believe is still here, or, you know, I know Rokia just popped back on. I can hand it back to you.
I've been listening. I took a quick potty break, but I'm here. And I also just want to invite folks, anyone who would like to share at this point, join the conversation, come into the room. I think that's very important. It's a very important time for us as communities of color to discuss, share ideas. Thank you so much, Jasmine, for leading that conversation. I actually didn't know anything about the enslavement. Can you say his name for me one more time?
Yeah, Onesimus.
Onesimus. Mm-hmm. I didn't know anything about Onesimus. And I love that I love when you said, vaccination is Black history. I didn't know anything about that. So, and it's really exciting to know that this is a part of our natural health practices. This is something that's been happening for many, many years. Mm-hmm. And for me, I'll say that, I think that I still have some concerns about, okay, yes, this is a wonderful, beautiful part of our history. And we are trusting this tradition with a system that hasn't treated us so well, right? And so, while I'm excited for this piece of history, those concerns still live, right? They still live. And, what does it look like to, what does responsibility look like? What does self-care look like? Those are the things that are kind of floating through my mind when I, am thinking about and opening, creating these opportunities for people to discuss the vaccine or to learn more. So yeah, any questions from anyone, any additional thoughts or things that you'd like to share during this time? This is a wonderful time to join the floor. Very low stakes.
Well, I think it's great to also go over, the history and how it plays into vaccine hesitancy. Mm-hmm. And I get that a lot, the idea of trusting a healthcare system and medical professionals and public health, considering the history, and not even the history, but current interactions. We know that a lot of times bedside manner isn't the best. And, even as an educated Black woman, I know that people respond to me differently when I say I work in public health. And I have to advocate for friends and family members. They put me on speaker when they're in an ER and reality. And so the other spin on it, which is not necessarily the general public health message that I say to folks is, okay, I get it. And I understand, you're not trusting these doctors. You're not trusting the healthcare system. And that's very, very valid. So when we're thinking about vaccination, let's limit our risk of contracting COVID so you don't have to put your life in the hands of the people that you don't trust. So the more vaccinated we become, the less likelihood we have of contracting COVID and having those potentially negative interactions. You know, we still have a long way to go as a society, of course, to mitigate that. But, you know, with that being a valid concern, one way, you know, we know that the death rates are very high for people of color. So often when it comes to emergency situations and hospitalizations, the number one thing, and what I've encountered as well, is feeling like, you know, we're not heard, we're not being listened to. And so, you know, if you don't want to interact with that system, consider the vaccine so you can lower your incidence of interacting with that system. And so just thinking about it in that way, you know, the typical public health message isn't that, but, you know, I'm also a part of the community and understand that, you know, there's levels, you know, essentially. So we have to also be thinking about that, you know. So another reason why COVID vaccination is highly important, especially in communities of color, is to minimize that feeling of not being listened to and that fear of that not being listened to, not being informed, and how it could have a really negative impact on our health. Mm-hmm. Being informed is important. You know, I've had vaccine hesitancy prior to moonlighting as a public health professional. No, I really work at public health. County. You guys haven't, I promise. But prior to working in public health, I was pregnant during H1N1. And so, you know, if those who aren't familiar, don't remember, it was back between 2009 and 2010. My daughter was born June 2010. And so during my pregnancy, I didn't know a lot about the swine flu, wasn't involved in public health at all, didn't even have a degree in it. And so I was fearful because, again, another scenario where we have a global pandemic, vaccine just coming out of nowhere to me, you know, just as a community member, and thinking about the same questions that I'm hearing tonight and that I hear a lot, you know, what are those potential complications, or will there be side effects for the baby? And so what helped me, and why, you know, what Jazzy was stating about being informed, which I love, is I, you know, have a doctor, and I still go, I'll shout it out now. I still go to Neighbor Care Rainier Beach. I've been with my doctor since I was 12 and I'm 35. And she's also the doctor for all 4 of my children. So I really, really believe in community health centers.
Give this doctor a shout out. Many of us are always looking for a safe person to go to.
Raji, Dr. Raji. You may not be able to get an appointment because she's so popular. Okay. Yes, Dr. Raji at Neighbor Care Rainier Beach. And so one great thing about my encounters, you know, I had that trust established with my doctor, but it's important, you know, to have those doctors that listen. And so what helped me was she wanted me to be empowered and informed. And so, you know, thinking about H1N1, pregnant women and children were the highest impacted during that time frame. Literally, you were turning on the news. It was presenting itself as like a respiratory infection, and then pregnant women were dying. And so it was literally a life or death situation. And COVID is no different. It is a life or death situation. And so what helped for me was, you know, my doctor being patient and just giving me the printouts and walking me through information about the vaccine, and even, you know, saying to me, we don't have to do this, you know, right here, right now. You know, why don't you take these materials home, think it over, and then if you know, want to move forward, make an appointment, you know. So I think it's really, really important. And I'm really, really grateful to you, Jazzy, for highlighting that, because informed consent makes the difference. You know, we, you know, here at Public Health we're trying to, you know, right some of those wrongs and be on the right side of history. And so we don't want to tell people what to do. We just want to give people the information that they need to make the best choices for them and their health. So absolutely.
Yeah, that was great. And I just want to, follow back on what you said earlier, Naisha, when you were saying, getting the vaccine and taking care of your health in that way can be one way you can prevent yourself from being left in the care of a system you don't necessarily trust. And I think that's a really good way to turn that around. I agree with that because I think we've all heard the horror stories of what's happening to people once they've contracted the virus and what happens to them after that in a hospital setting. And so recently at Open Arms, we had a doula who was supporting a family, and the mother tested positive for COVID, and they were just shoved into a room, right? And so we know that normally a family will have a nurse that stays with them consistently and have consistent monitored care. Well, what happened is they transferred this family and their doula to a completely different room and just left them there. Right. And someone came and poked in occasionally, and the doula was like, what, do I get any additional PPE? Like, what happens from here? Right. There was no one there to give additional information to prepare that family or that doula for what's next. They were just kind of left to figure that part out. And I thank goodness for that doula, right? Thank goodness that family had someone there to support them, because at that point, their medical providers had kind of washed their hands a little bit until it was time for the baby to come. And so just thinking about how, how really complex it gets and how varied your care can be, from facility, doctor to doctor, depending on the severity of your condition, all of that creates unknowns. So something to consider. So we have a question in the chat. They're asking, do you have any tips on talking with friends or family to encourage them to get the vaccine?
Well, I will say, I believe my colleague Araceli put in the chat our link for our community vaccination resources page. And it has a lot of handouts about the vaccine, especially looking at the 3 different vaccines and what people need to know, just general information and talking points. But just with initiating that conversation, I would say, just do it from an information perspective, not necessarily trying to convince people, or, it could get really, really passionate. And, I have friends and family who have been hesitant that I've actually been able to convince, but it didn't happen overnight. It was like a series of conversations, and well, we just received this more information. Look what we learned about the clinical trials, and just being really, really casual about it. I think is helpful, because people can become really, really defensive when you're trying to tell them what to do. So, initiate the conversation, but don't think of it as one conversation. A lot of us are parents here, so just think about when we have those sex talks with children, and it's, you continue to build on the conversation as, they get older. So same thing with talking about the COVID vaccine, just continue to build on that conversation. So, okay, we lay it out, probably starting with, okay, why? Thinking about the why. People are saying that they don't want to get vaccinated, and then just kind of work, because, it's different reasons for different people. When vaccines first came out, a lot of folks were like, well, wait and see. Well, now we've waited. Now we see, like, it's looking good. So what are you thinking now? Follow-up conversation, right? And so just also, in terms of educating people about the vaccine, whether it's, accessibility or just how the vaccines work, also just being very patient and respecting people's, thought process and, how they're feeling about it. And a lot of cases, it's just a lot of misinformation that is out about the vaccines. And so one way, we look at addressing vaccine hesitancy is, you know, providing information to counteract all of the misinformation that's available. For instance, you know, the vaccine was just created out of nowhere. Actually, mRNA technology has been around for over a decade and has been used with multiple different types of research. You know, it's actually been approved. Hey, let's look at the clinical trials. So it's different ways of establishing that communication, but I think it's important to really listen to what people are saying and their reasons why, and just taking that approach where I don't want to convince you, but hey, you know, here's some information. And if you change your mind and want to, or, you know, want to talk more about it, or, you know, if you just want to learn more about it, let me know, and just keep building on that conversation.
Now, this might be a little bit different, but in my community, some of my community, actually most of my community, they were very hesitant from the beginning, especially the elderly. Mm-hmm. But now, you know, they wanted to travel. They like to travel, especially now Ramadan is coming. They like to, you know, travel and the weather is getting warmer. So some of the countries overseas are saying that unless you have your shot, you cannot come in. Mm-hmm. So now they, you know, they are getting the shot desperately, not because they wanted to, but it's more like it against their will because they have to. You know, I mean, for instance, Saudi Arabia yesterday announced that they say if you're going to come visit the pilgrimage this year, you have to have your shot. So, and every year, 2.5 million to 3.5 million people visit the pilgrimage. Last year was canceled because of COVID, but this year they're allowing people to come in. So in order for them to go there, you have to have your shots. So I don't know. I just wanted to say that because I feel like, you know, the government should say, you know, that's not right. Some countries should not allow that, or some airlines, you know, international airlines are saying you cannot travel our airlines unless you have your shots. You know, and it should not be, you know, it should be against the law because everybody has right to refuse to get the shot or to say, yes, I can. What do you ladies think?
Well, I believe in choice. However, when we think about traveling and the potential spread, is also, we have to consider that the ventilation on the airplane, the number of hours you're on that airplane, and even thinking about visiting, I believe you said 2.5 million. The rate of transmission for COVID is so high. And then we have these variants that are spread more easily, are more contagious. And so it's not necessarily taking away choice, but it's more so making those decisions out of public safety. And, you know, there's other countries that require what we're calling medical passports, you know, depending on the incident of disease in their country, that will require different types of immunizations or vaccinations. So it's not a relatively new concept. I won't speak on whether it's fair or not, or right or wrong. More so, I'm looking more so at the reasoning for it. And so in this case, the reasoning is more for public protection, just because, you know, we're still dealing with COVID in a high capacity. The CDC is already advising for a fourth wave. And so we still have people who are eager to get out and return, especially as the weather gets warmer, to return to some sense of normalcy. And so with that also is coming with organizations wanting that additional protection, not even just for passengers and those traveling, but also for their staff. And so those are some of the considerations, you know, especially as, you know, we're kind of expanding those phases for people, again, to travel and to get around. You know, we're returning to sporting events, still social distancing involved, but, you know, there's a real eagerness from our society to, you know, return. I won't really say normal, because what is normal nowadays? But, you know, just return to some level of normalcy in terms of gathering and events. But, you know, it's kind of hard to social distance on an airplane. Even with those seatings, you know, it's airborne. And so still needing masks and still being considerate of, you know, the staff who are doing those routine flights, and then gathering in those spaces within those crowds could definitely be a breeding ground for COVID. So again, you know, I won't say it's necessarily right or wrong, but I could just provide a little insight to the reasonings for countries and organizations requiring that now.
Yeah, really great point. Thank you for bringing that up, Suad. Any other communities, any other trends or concerns coming up? Now's a wonderful time to bring it to the floor.
So this is Jasmine. I got my little one to calm down.
Yay. Welcome back.
Thank you. Yeah, this 1-year-old was just overtired. She's knocked out next to me now. But I just wanted to say I recently finished getting my second dose of the vaccine. I went to Odessa Brown, went to their weekend clinic that they have. And in talking with Dr. Bell there, you know, we had a really in-depth conversation of, like, I'm not over the harm and trauma that had been done to me by medical providers. I still didn't fully trust in it. And she acknowledged those feelings, which was big for me to be able to sit there and have somebody acknowledge how I was feeling, remind me how my feelings are very valid and how I don't need to get over anything before taking that step to move forward with getting the vaccine. That us addressing what has previously been done to our communities and done to us personally by providers, that's always going to be a process of healing. But in getting the vaccine, it was me taking that step forward to make sure I was keeping a healthy and safe environment for my kids. Because I know even for the state, my mom works for a school, and Washington State isn't even making it a recommendation for children until 2035. So to know that they want kids to be back in the classroom, to know that, you know, these classrooms are overcrowded. Not every kid is going to follow the rules. Not every family is going to continue to social distance, especially as the weather gets better. They're going to want to have play dates and go out and do things. But I needed to do my part as a parent to make sure I was staying healthy, to help my kids out and to not further possibly expose them either. But still just being able to take part in these conversations and to be able to say, like, yeah, I don't trust in it, and, you know, we'll see what happens in the future. But part of it was just I wanted to be responsible, and wanting to make sure that, you know, we're doing our part to take care of our community, because we see the other communities going and getting the vaccine. And I think that really helped in that too. I had a conversation with Jazzy B, and we were like, well, look what all the rich white folks are doing. They're going and they're getting it. You know, that's how they're keeping their wealth going. you know, they're not going to give that up. And so that was really an example too, and an eye opener of like, okay, like we see them doing it. They're making sure their community is still going to be thriving. We need to make sure ours is going to thrive in the future too.
Wow, powerful point. Wow. Yeah, I've heard similar sentiments. You know, some people's responses to, you know, vaccine hesitancy is, you know, well, again, you know, if all the affluent white identified folks are clamoring to get this vaccine, you know, then maybe the concerns about it being designed to harm people of color in some way is irrelevant, right? Something to think about there. Yeah, something to think about. Yeah, so actually, we actually have several doulas, birth workers, birth attendants in the room. And I would like to, while we have some more time, talk a little bit about what experiences have you been having out there attending births? What recommendations do you have for birth workers who maybe they couldn't attend tonight, but they'll get to watch this later? Any recommendations that y'all have? I know there are a bunch of us in the room. I don't want to have to call you out.
I was going to say thank you, Jasmine, for bringing in your personal story. I am also fully vaccinated. I got Moderna. And I felt the same way. I felt pretty similarly to Suad as well, is that I felt kind of pressured into getting it. It's coming up in interviews in doula work, is like, are you vaccinated? And it was happening sort of before pregnant folks were getting vaccinated, right? So I'm like getting vaccinated to work with people who were not getting vaccinated to keep me safe, and that is definitely like a dynamic that's happening. I think that a lot of like just working class folks and BIPOC folks are feeling more pressured to get it, or like we have to get it in order to maintain a level of safety in our work, or to travel to where, you know, our families are from, and that the decision sort of is getting made for us, and that we have to do a lot of work sort of in the moment to get really get comfortable quick, or to just honor our discomfort. And I think that doula work also, I've worked for different agencies and things that required that I was up to date with vaccination just in general, which a lot of folks don't believe in for their own like spiritual or biological reasons. And that like as a doula, that's part of what we navigate, is because we aren't medical providers, but we're navigating the medical industrial complex all of the time. So yeah, just honoring all of that, the sort of, I don't feel like I gave necessarily my full informed consent, that like circumstances are changing really fast. And I think that we're going to see that similarly in like a lot of different spaces, when this whole, you know, we recommend you get it turns into you have to get it. And I think that we're moving in that direction, and that we need to do the work of getting each other comfortable now. And going back to like Sarah's question and Naisha's answer, it's like, we just need to sit with each other and be that person that's listening if our providers aren't that person. Doula each other. We know what this is about. You know, we're going to actively listen and honor each other's emotional spaces as we try and heal around the medical industrial complex, and also just get comfortable with not having full control over all of this. COVID was a nightmare.
It is a nightmare that we have not been allowed to wake up from. It continues. And thank you, Jasmine. I did hear a little bit about a little bit of a response to my question around the experience that birth workers are having. And what you shared is that families are asking if you're vaccinated, right? And so that affects whether or not you're able to run your business. to actually be able to have clients. And that's a big deal, especially for an independent contractor or a private, you know, your doula work essentially is your small business. And if you cannot run your business, then, right, we're running into trouble. We're running into trouble. Anyone else from our birth community? Are you willing to share some about your experience? Or anyone at this point who would be interested to share? I don't want to limit it to just birth workers, but I want to keep the space inclusive. But I would love to hear more from our birth workers. How are things going for y'all out there? What are you encountering? What experiences are you seeing with pregnant and birthing people?
I think for me, in terms of my birth work, more so the family members of my clients are getting vaccinated because they want to be able to be around this beautiful newborn in their family, and have that time with them. And I'm seeing a number of grandparents that, you know, they were part of the generations that have been experimented on and having that historical harm done to them. But for family, they're getting it done because they know, you know, there's still just too many unknowns in terms of pregnant bodies and this vaccination, how it's going to affect newborns and lactation and fertility moving forward. But they really want to be involved. And so to protect their loved ones, you know, our elders are going and getting vaccinated. And I've just been seeing a growing number of that. And my clients asking me, hey, is it okay if my dad comes? He wants to be here. Baby just got home. I'm there to do a day 3. And just like, don't worry, they got vaccinated beforehand. And so just letting me know, them even taking the precautions to double mask so they can be there even while I'm there. But I'm seeing more of our elders getting vaccinated just to be able to take part, and to be involved postpartum and to help out with their new grandbabies. So.
Yeah, it sounds like we're hitting a wall with this, right? Like it's the benefits of the vaccine are beyond just protection from the virus, but actually, you know, contact and you know, safe encounters with family, being able to take trips, right? The list, it sounds like the list is going on and on. You know, so yeah, this is getting interesting. It's going to be really interesting. I think you're right, Jasmine B, that we may be on the precipice of, you know, beyond just a gentle suggestion, but really more a recommendation, more and more. So yeah, I'd be really curious to see how that goes. But yet and still, I know a lot of folks who are finding ways to get vaccinated. I know that El Centro de la Raza has a vaccination event coming up. You know, I know that the University of Washington has a mobile clinic and they're looking for community partners who are interested in hosting a vaccine event. So, and pretty shortly here, somebody correct me, I know within the next upcoming months, they're going to make the vaccine, I believe it's by May, they're making the vaccine available to everyone. Anyone who wants to have it, any age, that, well, no, still the limitation is no one younger than 16, but outside of that, it will be available to anyone interested in having the vaccine. So that will open up the floodgates and, you know, we'll see what happens from there.
Oh yeah, and I do want to add, so for those that are interested in getting the vaccine and wanting to be in a BIPOC community getting it done, Odessa Brown does host the vaccine clinics on the weekend. I believe last Saturday and this Saturday are for those who are getting first dose. They also host it on Sundays, and you can call Odessa Brown directly and be able to get on the list that they will give you. They'll take down your name, date of birth, your phone number, and then they will give you a call to let you know what time to come in, and they're having folks come in the morning to get it done. I know that they are carrying Pfizer. There have been a number of people requesting the Johnson & Johnson vaccine because of the one dose attraction to it, but they are being honest that the FDA may be looking at actually requiring 2 doses of that one too. But they do plan to carry those because they've had a number of people show interest in it just because of the 1 dose option.
Oh, wow. That's interesting. So that means they're going to have to retroactively call folks and be like, hey, we know you got the Johnson & Johnson vaccine. We need you to come on back in.
Yeah, they haven't started carrying it yet, but they were just like, yeah, we're going to have to be mindful with folks. If it changes, they got to know they're going to have to get a 2nd dose for it, because that 2nd dose is a booster. So,
right.
Yeah, I was just going to say it's considered a booster. Yeah.
Right. Okay, and so thank you to folks who responded in the chat. I'm seeing that by April 15th. That's
April 15th, yes.
around the corner, y'all.
Yeah,
the vaccine's going to be available to everyone.
Yeah, so the date for opening up the floodgates is April 15th for those who are 16 and over. 16 and over. And so the president, where you're hearing the May from, because I know where you got that idea from, the president has committed to having enough vaccine to vaccinate all that are eligible 16 and over by May. So
got it.
By the end of May. So both are correct, essentially.
Okay. Thank you. Okay. Thank you for that clarification.
Yes.
Awesome. Awesome. Okay. Wow, you guys, you know, it's a tiny bit early, but still, I feel like we had some really amazing dialogue. Before I close the meeting, I just want to ask again, are there any last minute questions, concerns, comments, or even responses to my question around, you know, what can we share with any birth workers out in the field that might need more information or support or ideas around what themselves and the families they serve are encountering? Silence on Zoom is so hard. I'm always like, oh, it's only been 2 seconds. Oh God.
Especially when you're on camera.
Yes, yes. Especially when you're the host and you're like, come on, people. Yeah, but it's okay. It's okay. It means that people are gotten what they need, or I hope that people have gotten what they need. And so there's nothing wrong with that. There's nothing wrong with that. Yeah, I don't know. I feel like maybe we should do more of these or something more like this. This is actually my 2nd COVID event. The first one I just hosted myself and taught myself and created my own PowerPoint and was like, we gonna do this. And I think that went really well. That was in partnership with Families of Color Seattle. And so this one, obviously, I'm getting to do through my work at Open Arms. And yeah, this was our first community speaker series. If any folks have any ideas on doing another one, or even on doing one on a different topic, I am happy and open to keep this going. I think that we had some really great dialogue, some real dialogue that's only happening in our homes, pillow talk, right, under the covers, behind closed doors. And I think the more we raise the veil, right, and you know, just like to Sarah's question, how do we encourage people to get the vaccine? It's through discussions like this. It's through sharing information, like Naisha was sharing, you know. It's through the sharing of information, sharing factual information, sharing from trusted sources. You know, even if that trusted source is your neighbor, if we get your neighbor informed, then we get the people the information they need. So yeah, yes, you are getting thanks and praises in the chat. And so I will do the same. I will take the opportunity to thank Esther Min from UW. Thank you so much Your talk is so technical, but so valid, so needed. Big thanks to Naisha Williams. I feel like we are kindred spirits because we just giggle and smile our whole talk. So I enjoy, I really enjoy hearing you speak. And Naisha spoke. I also am a part of a group of folks called Community Navigators through King County Public Health. And Naisha came and spoke with us, and that was so wonderful. And I was like, okay, you felt so familiar, down to earth, and it was such a comfortable experience getting the information with and from you. So I wanted to share you with the community. So I'm glad you came. And my final, last but not least, definitely not least, special thank you to the ladies of Surge. I'm sorry, ladies may not be the appropriate pronoun, forgive me, to the wonderful folks of Surge Reproductive Justice Northwest. I am so grateful for you all to have attended. And I really appreciate you leading that discussion. Again, like I said, it's one of those things that's happening behind closed doors, but behind closed doors doesn't serve the larger community. And so I really appreciate you leading this discussion and inviting Naisha back in, because I felt like we even got more rich dialogue when we all kind of, you know, loosened our ties and got comfortable. So thank you so much. Seriously. Thank you to all the community who came. This was exciting. And I expect to, I'm recording this, like I shared prior to my speakers that I've been recording. And so I expect to share this on the Open Arms YouTube page. So for folks who weren't able to attend, it'll probably also be on the Open Arms Facebook page. And so if folks who weren't able to attend, or if you just wanted to be able to share this again and share it widely so that more folks can get the information and make an informed choice, I think that would be wonderful. Please share widely. Okay, and with that, I bid you all adieu. Have a wonderful evening. If you haven't eaten dinner, please go nourish yourselves, take care of yourselves. Thank you so much for your spending time with us this evening. Take care.
Thank you, Rokia, for all you do.
Woo!
Thank you for having me.
I was white knuckling and I was like, it's today. Hi, Vonda. It's good to see you on camera. All right. Thank you, Seely, for coming.
Bye.
Thank you, Betty. Bye. I see you in there. Thank you, Ashley, for coming. Thank you for helping me promote this event. Thank you, Deandra. It's so good to see you, or at least see your name. So thank you to the Open Arms family who showed up. All right, you guys, we made it. It's 7:28. I'm gonna shut this baby down. All right. Good night.
Good night.
Good night.